wet gauze. And I'm just going to put this bipolar on its quads. That's not a real common setting that you would use this for.
Keeping it out here, right?
Yes.
I don't want wet electricity.
Okay, I'm going to go slightly medial for the distal one and slightly lateral for the proximal one.
The Watson Garter.
Probably would have a slightly bigger bolster under there because that's not really at mid-range, but you'll be able to see the options here. Okay, I'm not using the dispersive pad, so I just have it on pads, which makes this knob ineffective. This is positive, this is negative, so that doesn't matter anything. It's on pads, okay? I'm going to go through the 4 selectors. So this first one is going to be continuous high rate. We're going to go for a motor response so you see it. So you have to sometimes palpate and look instead of just looking here, because once it contracts, that's it. You miss that contraction, you missed it. He'll feel it first. It'll wiggle, wiggle, squiggle, squiggle then, and then it'll... Are you ready? Okay. Time. Here we start turning it up. Tell me you start to feel it.
Now it's wiggling.
I can see it.
Is it wiggling?
Okay, so this way, this way, this way.
Yeah.
Oh, yeah.
Oh, wow. Yeah. Do that.
That is true.
There it goes.
Yep, I can see it.
There we go.
Oh my gosh.
And it's just holding.
Is it hard?
Very hard. I think it's already.
That's not contracted all the way.
So they don't have like a surge option on that machine. So you wouldn't really use that
Now
machine.
he's at almost 50 milliamps. But it's just going to do that. So for a spasm where you're wanting just to hold and do, fine. Or the sensory level for pain, you just turn it up to the sensory. Okay? Now for selector 2, he should be about the same intensity as he is here. But I'm going to turn it back, I'm going to back it down.
He was wondering when you were going to do that.
Okay? And I'm going to go to 2. Now 2, it'll... Okay? I don't know how you document that. Here we go, warm you warm
That's really doing it.
So you can see how that would pump for edema. As close as we're going to get for muscle rib. Okay. So now I'm going to turn it down. Selector 3 is continuous low rate. It's going to look like a heartbeat in this muscle if we turn it up to a motor response. It's not going to grab and hold, it's going to thump. The intensity tends to be different on a low rate than a high rate, so it may be, it probably won't be the same, and I don't want to switch selectors while it's still up there. So we go to 3.
It's doing it on its own.
There we go.
Hey, we can put that on your pecs.
I just take this home and get a workout.
And that's pretty much what it's going to do the whole time.
How long
So
would you
for
normally
chronic
go?
pain, depends on what you're treating. Okay, chronic pain I need to go longer because that's tough for probably 30 minutes. Acute pain, 15
30
minutes.
minutes of that? Wow.
But I may not have it motor. If I had it transarthral, and he may just feel a thump without any motor response. Now 4, I'm going to go ahead and switch because it's still continuous low rate, should be the same. But it's going to do, hang on, there it goes, 5 pulses per second. And then 2.
So why was it pulsing earlier on the continuous? I mean, this one
It
is at least
wasn't pulsing, it was getting to
It was just my
contraction.
muscle.
You know, you have to have a threshold before it fires off the tetanic response. It was getting there. I didn't have quite enough intensity to fire off.
I think Hannah should go now.
Okay, so if you want to kind of do this just to feel what the different selectors feel like, that's fine. And then in your groups, think about, well, what if I was treating this? What setting would I use? Where would I put it? You know, within your time. But get a feel for it and then do some problem solving thinking about how you would set the patient up, how you would place these.